Hello everyone, my name is Tran, and I would like to present to you the biopsychosocial model in health communication. The medical model in health communication is very popular amongst physicians and advanced practice nurses because they utilize the medical model as part of the toolkits to communicate with their patients. So, what is the medical model in health communication? It is defined as a type of health communication that is influenced by intrinsic causes of health and illnesses. And there are two models within the medical model. One is biomedical model, and the second one is biopsychosocial model. So, what are the differences between these two medical models? For a biomedical model, the focus is on reductionistic view of health. Basically, those who utilize this medical method, communication method, tend to think that all phenomena are best understood at the lowest level of natural system, such as the cellular level or molecular level. Therefore, poor health can be explained, identified, and treated with physical means. For biopsychosocial model, the focus is on holistic view of health and health problems. Therefore, with this approach, it systematically considers biological, psychological, and social factors and their complex interactions in understanding health, illness, and healthcare delivery. The founding father of the biopsychosocial model are Dr. George Engel and Dr. John Romano. They believe that poor health is not only influenced by biological factor, it is also influenced by the patient's feelings, health ideation, as well as life events. So this is a comprehensive look of the biopsychosocial model. From the very top, as you can see, it is health ideation. It is basically what the patient's idea of being healthy is. Pathophysiologic, that would be the biological explanation of a disease, a pathology. Third component is feelings, patient's feelings. Fourth is life events, things that have happened in patient's life. Fifth is patient's needs. What do they need in order to reach their healthy goal or their goal as being considered healthy by themselves? And the last one is literacy levels. It is very important that we, as healthcare provider, we would assess the level of literacy of our patients because a lot of health communication would rely on the patient's ability to understand and to comprehend um, what we're trying to tell them so that a better patient relationship, a patient healthcare provider relationship, as well as ensuring that all health information will be transferred over to the patient. So, how is utilizing the biopsychosocial model helpful? Well, first, it show your empathy to the patient that you're caring for. Second is to being sensible to the patient's needs and feelings. Third is to generate an understanding of where the patient is coming from as far as their background, and this goes hand in hand with life events. And the fourth one is motivational, because by gaining understanding into the patient's life, that would be psychosocial. social part, then we'll be better at formulating a plan for the patient. So in return, that would help to build a better um, healthcare provider patient relationship. So how can we apply the biopsychosocial model to our practice as future advanced practice nurses? Well, we should first of all recognize the importance of patient provider relationship is vital to care and to a better outcome. Second is to use self awareness as a diagnostic and therapeutic tool. Third is to elicit patient's history in the context of life circumstances. And the last one is to decide which aspect of biological, psychological, and social domains are most important to understanding and promoting the patient's health. So, did everything that we have talked so far sound familiar to a model of care that, as nurses, we have been practicing? Yes, it does. It is actually a holistic care, which is what we as nurses were taught in nursing school, and that's how we've been practicing as nurses, is to look at a patient and caring for them holistically and not just focus on one aspect. So this is very familiar and very similar to the biopsychosocial medical model. Um, Therefore, since we're already familiar with it, um, some of us may not know the name, and I do not know this is the name of the type of health communication that I have been providing or utilizing in my nursing career. Um, so, moving forward, we'll continue on with what we do and perhaps implement or incorporate more of this biopsychosocial model into our practice. Thank you. Thank you everyone for listening to my presentation, and I hope you enjoyed it.